Dear students, welcome to another session on the portion we have been discussing so far, the mental health. This time we are going to discuss the childhood mental disorders and illness. World Health Organization has recognized that the health of children and adolescents are very essential for the development of any country, especially the low-income countries throughout the world. Let's see the consequence of mental illness and childhood. They have got very far-reaching consequences in academic, social, developmental, and physical aspect of any society. Broadly, the mental illness and disorders in childhood are categorized into 8 types: mental retardation, pervasive developmental disorders, learning communication and motor skill disorders, attention deficit disruptive behavior disorders, attention deficit hyperactivity disorder, conduct disorder, oppositional defiant disorder, then suppression anxiety disorders. Let's see the mental retardation in detail. The main characteristics of the mental retardation is that they have got a very low IQ, especially below 70, and 1% of the population in each country suffers from this, especially the males. Main characteristics of mental retardation is that they have got deficit in most of the intellectual aspects, and they will be having impairment in adapting to everyday affairs in life. Then lack of social skills and judgment will be there. Then difficulty in communicating with the peers and other people in the society, and the main character is that they will be unable to care for themselves. And the causes of mental retardation. We have already discussed that they have got an intellectual deficit, and the main cause is the genetic cause, that is the chromosomal abnormality that is happening with gamete formation. Especially the gametes, the number of chromosomes will be varying during the gamete formation. For example, Down syndrome, that is an extra 21st chromosome will be present in each cell of these people. And other causes are environmental. Exposure to certain drugs or toxic chemicals, then maternal malnutrition or infection to mother at critical stages of the fetal development. For example, mother who contract rubella during the time of pregnancy will be having a mentally retarded child. That's why rubella vaccine is highly recommended for the girls. Then fetal alcohol syndrome. What is fetal alcohol syndrome? These are the mental birth defects results from a mother's alcohol consumption during pregnancy. It affects the fetus. The next one is pervasive developmental disorder. The main characteristic of pervasive developmental disorder is that persistent impairment in several areas of development will be there, especially the social interaction communication skill will be badly affected, or there will be presence of extremely odd behavior, interest, and activities. We have seen the people having autism. Then autism in detail. Massive impairment in an individual's ability to communicate and relate emotionally to others. They will be having particular features that we can call idiosyncratic. Then delay or abnormal functioning in social interaction. They will be very abnormal compared to the normal people. Let's see the symptoms of autism. Impairment in social interaction. So first one, they will be having some abnormal non-verbal behaviors such as the facial expression, body postures, and eye contact. All will be different from normal people. Then we can observe some impairment in developing appropriate peer-to-peer relationship in this type of people. And these people will have failure in spontaneous sharing of enjoyment, interest, or achievement with others. And they won't have social or emotional reciprocity with the people around. Then symptoms of autism, impairment in communication. They will be having a certain delay or lack of spoken language development during the childhood. Then impairment in the ability to initiate or sustain a conversation. Then stereotyped or repetitive use of language or idiosyncratic language that we have discussed a few while ago. This type of people exhibit particular pattern in all their expression and language. That's what is called stereotyped or idiosyncratic. Then lack of spontaneous social imitative play. Symptoms again, restricted, repetitive, and stereotyped patterns. Yes, already discussed it. Behavior, interest, and activities. Preoccupation with stereotyped or restricted patterns of interest. Inflexible adherence to non-functional routines or rituals. We don't want to explain this much because it's already explained the sentence itself. Then stereotyped and repetitive motor mannerisms or hand flap. A particular behavior, a particular type of expression will be always repetitive. That is what is called idiosyncratic or stereotyped behavior. Then preoccupation with parts of objects. Some parts of objects will be routinely or repetitively handled by this type of people without any purpose. So one with autism will show at least 6 of the symptoms we have mentioned so far. And the treatment for this disease or treatment for this disorder involves the work with the family, peers, as well as individuals with the disorder. Next, childhood mental disorders: learning, communication, and motor skill disorder. Let's see which are these disorders. First one is a learning disorder. There are mainly 3 types of learning disorder. Learning disorder can be referred to as a delay or deficit in academic skills. And the first one is a mathematical disorder. There are some people who find it often difficult with dealing with mathematical problems. And some people often find it difficult with writing tasks. They may exhibit errors in spellings, grammar, punctuation, or organization of the paragraph. And yet another one is a reading disorder. These people omit, distort, or substitute some words when reading, and they often read in a very slow and halting fashion. Let's see next disorder, communication. They may often have a particular pattern or impairment in the expression or understanding of language. Expressive language disorder is the first one. Problem in verbal expression. They will be having difficulty in expressing what they actually mean. But in the case of mixed receptive expressive language disorder, the people will have difficulty in both expressing and understanding, or reception and expression, or understanding and expression, or certain kinds of words or phrases. Then another one is the stuttering or disturbance in the normal fluency. That's what is called stuttering. And patterning. Fluency and patterning will be stuttered, and that will be characterized by sound repetitions and prolongations and blocking of sounds. Okay, we can go to motor skill disorder. Motor skills will be affected badly or impairment in the development of some. The main characteristic of this disorder is the impairment in the age-related tasks in the early years of their lives. As they grow, they will be unable to do even common activities like tying the shoelaces, playing football, or completing a puzzle, or even writing legibly. Next one is the attention deficit and disruptive behavior disorder. As name indicates, there will be deficiency in attention, and there will be a disorder called disruption in everything. These people or these children will be disruptive and provocative. People will find it very difficult to deal with this type of children because they are highly active. They will be provocative, or they will be disruptive. They will be not normal. The caretakers and peers or the classmates or the fellow children may respond to these children with anger, impatience, and avoidance because of their disruptive and provocative nature. Another one is the attention deficit hyperactivity disorder. It's almost like that of the earlier one. And these ADHD is characterized by inattentiveness and hyperactivity or impulsivity. There are three types. First one is the combined one, or inattentiveness and hyperactivity will be combined in these children. And second one is predominantly inattentive, and third one is predominantly hyperactive. Then inattentiveness. What is meant by inattentiveness? They will not be attentive, or they cannot attend in any activities, or they will be careless, or they will be forgetful in daily activities and other attentional problems. See, this is characterized by following symptoms. They will be careless, or they will make careless mistakes, or fail to attend to details of each and every activity. They will not be able to listen when spoken to them, and they will not be able to follow through on instructions or responsibilities. They will be having difficulty in organizing activities. Then avoid tasks requiring sustained mental effort. They cannot impose mental effort, or they cannot give sustained or attentive mental effort in anything. So they will be avoiding that. They will lose items necessary for tasks. They will be forgetful. Then it's easily distracted. They cannot concentrate on anything. So they will be distracted easily from everything. Then these people are highly forgetful. See next one, predominantly hyperactivity or impulsivity. These children are rough, impatient, and they'll be having an on-the-go manner, characterized by fidgets and squirms. They'll be rough in everything. Then leaves seats inappropriately. They'll be restless. Then runs about or climbs excessively when it is inappropriate. A disordered activity. Then you will be having difficulty in engaging leisure activities. They will be having an on-the-go manner, or act as if driven by a motor. They will not be, or they will look like they have been charged, or they have been driven by a motor, or they will look like senseless. Then they will talk excessively. Then blurts out answers before questions, and have difficulty in awaiting their turn. They will often make trouble in every order, then interrupts and intrudes. Next one is the conduct disorder. Means in the normal behavior, the normal manner, there will be some disorder. Repetitive and persistent violation of the rights of other people. Characterized by stealing, truancy or being absent, then running away from home, lying, fire-setting unwantonly, then physical cruelty to people and animals, sexual assault and mugging, may abuse alcohol or drugs, deny guilt, shift blame to others when they are caught, lack sorrow or regret about the consequences of their misdeeds. Don't think that all these symptoms are coming in the persons who are having conduct disorder. At least some of these items or some of these symptoms will be present in the children with conduct disorder. Next is oppositional defiant disorder. See the main characteristics. They will be having a pattern of negative, hostile, and defiant disorder. They will be having an attitude or negative attitude towards everything, or they will be having an enmity to most of the principles and practices, and they will be having a rebel-like attitude or behavior. And it is mostly seen in between the 8th and 12th age, characterized by 4 or more following symptoms. They will lose temper unwontedly. They will argue with adults, then actually defy or refuse to comply with adults' requests or rules, or common practices or principles will be questioned by them. Then deliberately annoy others. They will be annoying others unwantedly. Then they will blame others for their mistakes, and
misbehavior. They will be angry and resentful, or they will be offended every time. They will be having complaint every time. They will be spiteful, or they will be unpleasant and vindictive. So next one is a separation anxiety disorder. From the name itself, we can understand what the disorder is. They will be having an intense psychological attachment with parents and anxiety in their absence. They will be always worried about being separated from their parents or significant others. Characterized by recurrent excessive distress when separating from home, parents, or significant others. This anxiety disorder is evident in the case of children who are separated from home, maybe because they have to study in the boarding schools, or they have to stay in hostels. You can see that homesickness. Then worry that harm may occur to attachment figures, or they will lose them. They will think that their parents will be harmed by some of the reasons. So they will be always bothered about their parents. Then worry that they may get kidnapped and get separated from their caregivers. These children will unwantedly think that they will be kidnapped or separated from their parents. Then a refusal to go to places such as schools because of the fear of separation, that's common. Then fear to be alone without the attachment figures. People will be always thinking about being alone, or they'll be always needing a company with them. Then may be reluctant to go to sleep without being near the attachment figures. They can always live with their parents or significant others. So they cannot have an independent life. They'll be having repeated nightmares involving separation. There'll be repeated complaints of physical symptoms when they anticipate a separation. That's very funny. See, these are the main childhood disorders. You may please replay and stop your graphs. So these much points will be enough for you to have a very good detail or very good account on the childhood disorder. Have a nice day.